So at this year's EHA meeting, I was happy to present these updated long-term data from the phase 2 REVIVE study for Rusfertide in patients with Polycythemia Vera. As you may know, PV continues to be a real challenge to us in clinic, and of course, for the patients who deal with it. Our standard treatments have the goal to achieve and maintain a hematocrit less than 45% in order to prevent thrombotic events, which we do through primarily therapeutic phlebotomies for those at lower risk, and also with the addition of cytoreductive therapies for those at higher risk. But therapeutic phlebotomies aren't always the easiest. There's a lot of time, travel, and venous access required. And eventually, with repeated therapeutic phlebotomies, patients become iron deficient, which can worsen some symptoms like fatigue and brain fog. And also, phlebotomies aren't always the most effective at consistently maintaining our hematocrit goal less than 45%. So with Rusfertide, this peptide mimetic of hepcidin, which is a protein that sequesters iron to its long-term storage sites and restricts its availability for erythropoiesis, our goal is to maintain that lower hematocrit level for patients with PV more consistently and to minimize the need for these repeated therapeutic phlebotomies. So with all that in mind, the phase 2 REVIVE study has been going on for some time. You may have seen results at previous ASH or EHA conferences and also published in the New England Journal of Medicine recently. And overall, what we've seen is significant efficacy in terms of the ability to control the hematocrit to less than 45% consistently in this patient population with PV who were previously heavily phlebotomy dependent. We've also seen that the estimated annual phlebotomy needs decreased from nearly 9 phlebotomies per year pre-treatment down to less than 1 per year and 0 per year for most patients on Rusfertide, and also seen that Rusfertide is well tolerated. So this year at EHA 2024, what we presented was updated long-term data for Rusfertide in this study. We now have experience for most patients out to more than 2 years, and for many patients for more than 3 years of treatment with Rusfertide. So what we've seen is that the initial hematocrit responses and freedom from phlebotomies that we've seen with Rusfertide are maintained over this longer period of time, which is very encouraging for us and our patients. So out to 3 years of treatment, we've also seen no new safety signals of concern, which is also very encouraging. The most common adverse events we see are still grade 1 or 2 injection site reactions, which tend to improve over time. And otherwise, any other serious adverse events reported are consistent with what's expected in this patient population, which are namely vascular events and other malignancies as the years go on. We often do see an early rise in the platelet count with Rusfertide, as we've reported before, but now we've seen that this platelet count stabilizes out or even decreases somewhat over the years on Rusfertide, and that this has not been associated with any clinically significant events like bleeding or clotting. We've also seen that ferritin levels rise nicely, and while they've continued to rise out to year 3 of treatment, they seem to stabilize beyond that point and generally remain within normal ranges. And we haven't seen any signs of clinical iron overload. Thrombotic events on study have been rare, and all have been among those with higher risk PV and many in those with prior thrombotic events as well. Second, malignancies have been reported at increased risk, of course, in patients with PV in general, and especially those on cytoreductive therapy. And we're watching that closely as part of this study. On REVIVE, we've identified 11 patients with second malignancies. Most have been skin cancers, mainly basal cell lesions and 2 early melanomas. Most skin cancers were identified during the mandatory dermatologic exams that were instituted by the study, which has allowed them to be identified at early time points and all treated locally. We also showed that the rate of secondary malignancies thus far is not associated with the cumulative increase in Rusfertide exposure over time, which is reassuring. But of course, this is something that we'll need to keep an eye out for long-term studies. So as far as those long-term studies, nearly all the patients on the REVIVE study are rolling over into a long-term follow-up study that's called THRIVE. And in that study, we'll continue to monitor the long-term efficacy and tolerability of Rusfertide. And then the next study of Rusfertide that's going on is called Verify. This is a phase 3 study randomizing patients with phlebotomy-dependent PV to either Rusfertide versus placebo. And this should answer some of our ongoing questions about efficacy and about symptoms and about quality of life changes for this patient population. The Verify study is now fully accrued in a short period of time around the world, which really highlights the unmet need for this patient population. And we expect to see data presented in early 2025.